Welcome to the Senior Safety Advice Podcast, your trusted source for expert guidance on aging safely and independently. Whether you're a caregiver, a family member, or a senior looking to stay secure at home and beyond, we've got you covered. From fall prevention and home modifications to financial safety and scam awareness, we provide practical tips to help you or your loved ones live with confidence. Tune in and empower yourself with the knowledge you need to navigate the challenges of aging. Let's make safety simple.
Welcome to the Senior Safety Advice Podcast, where we help you add more life to your years and wisdom to your choices. I'm your host, Robin Schultz, and today we're diving deep into a topic that, let's be honest, can be a bit like standing in a corn maze with a broken GPS. Medicare. That's right, this episode is all about navigating Medicare and understanding your options and benefits. So whether you're nearing golden age of eligibility, exploring options for a loved one, or you just want to impress your friends with your timely Medicare knowledge, stick with me. By the end of this show, you'll be better equipped to make smart, informed choices about your health care. No compass required. So let's start at the very beginning. What on earth actually is Medicare? At its core, Medicare is a federal health insurance program primarily for people age 65 and older, although it also covers some younger folks with disabilities and those with end-stage renal disease. Medicare was established in 1965, and if you think it's just health insurance for seniors, well, that's only half the story. It's actually a collection of different parts, each with their own quirks, benefits, and yes, occasional headaches. Think of Medicare like a choose-your-own-adventure novel. Your choices, your path, your outcomes. But don't worry, I promise we'll make the navigation clear and maybe even a little fun. There's 4 parts of Medicare. It's alphabet soup. I'm going to explain it. If you've ever heard people talking about Medicare, you've probably heard references to Part A, Part B, and then there's Part C, Part D. Sounds suspiciously like a bad quiz show, doesn't it? Well, let's break down this alphabet soup. Each part of Medicare covers different things. Part A is hospital insurance. It covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Fun fact, for most people, Part A is premium free, as long as you or your spouse paid Medicare taxes for at least 10 years. Imagine you're in the hospital for a surgery. Medicare Part A typically covers your inpatient stay, certain medical supplies, and even some meals while you're there. It won't, however, pay for your streaming subscription when you're bored. Sorry, Netflix lovers. Part B, medical insurance. It covers doctor visits, outpatient care, preventive services, some home health, and durable medical equipment. Part B does require a monthly premium, which can vary based on income. Each year brings updates on what preventive services are covered also, things like flu shots, mammograms, and diabetes screenings. And while you might get a little queasy with all these procedures, take comfort. Part B means fewer surprises and out-of-pocket shocks. Moving on to Part C, Medicare Advantage plans. It's an alternative way to get your Medicare benefits through private insurance companies that are approved by Medicare. Why consider it? Well, these plans often bundle Part A, Part B, and sometimes Part D, which is prescription drug coverage, into an all-in-one package. Many also toss in extras, maybe dental, vision, sometimes even gym memberships. But coverage, benefits, and costs can vary a lot by plan and where you live. Medicare Advantage is a bit like upgrading your vacation package, from the basics, flight and hotel, to an all-inclusive resort. Free umbrella drinks, anyone? Moving on to Part D, prescription drug coverage. As we age, medicines often become a daily reality. If you want help footing the bill for prescriptions, you'll need to enroll in a Part D plan, which is offered by private insurers. Another heads up. Every Part D plan has a formulary, a fancy word for the list of drugs that are covered. It's important to make sure your specific prescriptions are included. Here's a quick tip. Parts A and B together are often called Original Medicare. Think of Part C as Medicare, but make it a combo meal. Segment 3 are the enrollment essentials, the how, when, and why it matters. All right, so we've got the lay of the land, but how do you actually get Medicare? Can you just wait for it to show up in your mailbox like your favorite catalog? The short answer is sort of. Here's what you need to know. First, we're going to discuss the initial enrollment period. This is a 7-month window. It starts 3 months before you turn 65. It includes your birthday month, and it lasts 3 months after your birthday. Missing it, you could be hit with a late enrollment penalty and those penalties can last as long as you have Medicare. Yikes! So set a calendar reminder, tie a string around your finger, do whatever you need to do to sign up when you hit 65. Now there are special enrollment periods. Life happens. Maybe you're still working past 65 and you're covered by an employer plan. If so, you might qualify for a special enrollment period when your situation changes, like retirement. Then there's a general enrollment period. If you missed your initial chance, the general enrollment runs January 1st to March 31st each year. But remember, waiting may mean higher premiums and a gap in coverage. Here's a fun visual. Picture Medicare like a cruise ship. If you board at the right time, you sail smoothly. Miss your window? Well, the next ship might charge you more and the buffet closes early. Now, segment number 4, we're going to talk about Medigap and plugging the holes. Original Medicare, Parts A and B, is great, but it doesn't pay for everything. That's where Medigap or Medicare Supplement Insurance comes in. Medigap is sold by private companies. These plans help pay some of the costs Original Medicare doesn't, such as copays, coinsurance, and deductibles. Medigap plans are standardized, so Plan A, B, C, D, etc. Yep, more alphabet soup. So a Plan G from one company is basically the same as a Plan G from another. The biggest difference is price. Who should consider Medigap? Well, if you want predictability in your out-of-pocket costs, Medigap might be appealing. But remember, you can't have both a Medicare Advantage plan and a Medigap policy at the same time. So let's find out what Medicare does not cover. You may be asking, okay, what about dental work? Eyeglasses? Hearing aids? Well, you're not alone. Original Medicare does not cover most dental care, eye exams for glasses or contacts, hearing aids, long-term care like nursing homes, or routine foot care. If these are important to you, you'll need to explore either a Medicare Advantage plan with the benefits you need or consider standalone insurance. All right, let's make Medicare a little less abstract with a couple of real-world scenarios. Scenario 1 is the classic. Meet Harold, age 67, who recently retired. He wants the simplicity of Original Medicare, but gets nervous about the 20% coinsurance every time he visits the doctor. So he decides to enroll in Part A, Part B, and he adds a Medigap Plan G for predictable costs. He also picks a standalone Part D for his prescriptions. The next scenario, number 2, is the bundle up. So in this scenario, we're meeting Dolores, age 70, who lives in an urban area with many Medicare Advantage options. She wants dental, vision, and a fitness program all wrapped into one. So she finds a Medicare Advantage plan that offers those extras with low copays. Then there's scenario 3, the still working after age 65 person. Mona, age 67, is still clocking in at her law firm and has employer health coverage. She delays Part B until after she retires to avoid paying for coverage she doesn't need and uses her special enrollment period later. Your path may look different, but that's okay. So now let's talk about navigating the costs for premiums, deductibles, and out-of-pocket limits. Part A premium is free for most, but if you paid less than 10 years of Medicare taxes, you will pay a premium. Part B premium, everyone pays. The amount is based on your income. And Medicare Advantage, Part D, and Medigap, the premiums and out-of-pocket costs vary by plan, insurer, and location. Original Medicare does not have a yearly out-of-pocket maximum. That means your share could reach tens of thousands of dollars if you have serious health issues. Medigap or Medicare Advantage may help to cap these costs. Before we wrap up, let's hit some rapid-fire advice. First, don't miss your enrollment window. Late penalties are no joke. Review your plan every year during Medicare's annual enrollment period, which runs October 15th to December 7th. The plans and your needs can change. Double-check drug formularies. Make sure your medications are covered before you sign up for a Part D plan. And avoid scams. Medicare will never call you asking for your Medicare number or your banking information. You don't have to navigate this minefield alone. Here are some trusted resources. The official government website, medicare.gov. State Health Insurance Assistance Programs, or SHIPS for short. They have free unbiased counseling. You can also talk to your local area agency on aging. And of course, us at seniorsafetyadvice.com. We have plenty of guides and a full support community. So congratulations, you made it through the Medicare maze. Hopefully you're feeling more confident and a lot less confused. Remember that Medicare isn't one size fits all. Take time to research, ask questions, and weigh your options. It's your health, your future. Make it count. If you found this episode helpful, please share it with a friend. Don't forget to subscribe for more episodes and check out seniorsafetyadvice.com for more resources and support. Until the next time, stay savvy, stay safe, and take care. Bye-bye.
That's it for today's episode of the Senior Safety Advice Podcast, helping you and your loved ones stay safe, independent, and informed. If you found this episode helpful, be sure to subscribe and share it with others who could benefit. For more expert tips and resources, visit seniorsafetyadvice.com. And remember, staying safe starts with staying informed. Until next time, take care and stay safe.